Today the topic of discussion is on topical fluorides. There are various videos in our YouTube itself related to topical fluoride. Myself, I'm going to focus mainly on the NEET-oriented questions related to the topic topical fluoride. So, remember, first, who gave the definition of topical fluoride? So, the definition of topical fluoride was given by Stuckey. Stooky. Stuckey. The definition of topical fluoride was given. Now, basically, what is topical fluoride? Topical fluoride is nothing but dose delivery system which provides fluoride for a local chemical reaction to expose surface of erupted dentition. So, remember the definition was given by Stuckey. So, basically, topical fluoride is nothing but you apply fluoride topically. Okay, they are into two types. One is professionally applied, which we dentists apply professionally, self-applied, whereas the participants apply in their home. So, professionally applied includes 5 types, which includes prophylactic paste, fluoride varnishes, gels, foams, and restorative materials. Whereas self-applied includes dentifrices, mouth rinses, gels, and solutions. So, fluoride varnish was given by Smith in the year 1964. So here there are 3 types of fluoride varnishes. One is the Durafet, second is the floor protector, and third is the Carex. So Durafet was the percentage of caries reduction permanent teeth was 30 to 40%. Whereas in primary dentition it was 7 to 44%. So here you have to remember the ppm for Durafect, Fold Protector and Carex. For Durafect it is 22,600 ppm. For Floor Protector it is 7,000 ppm. And for Carex it is 18,000 ppm. These are the important ones related to fluoride varnishes. 3 types of fluorides varnishes. What are the ppm for each fluoride varnishes? And for Durafect you need to remember 30 to 40% reduction in caries in permanent dentition and 7 to 44% in primary dentition. Next comes the fluoride gels. Here they are 4 types of fluoride gel. One is neutral sodium fluoride, second is stannous fluoride, third is acylated phosphate fluoride, and fourth is amine fluorides. In sodium fluoride, you need to remember these 5 points. One is what percent of sodium fluoride is used. The option will be 2%, 8%, 16%, 24%. So that time you have to tell that sodium fluoride, 2% of sodium fluoride is used. Here the technique used is Knudsen technique, which is important one word. Knudsen technique, remember. The solution of pH is 7, which is a neutral solution for sodium fluoride. And there are 4 visits of procedure for sodium fluoride. It is 3 years, 7 years, 11 years and 13 years. So remember this term in sodium fluoride, which is called the choking off effect. Now what is choking off effect? I'll be telling you in 2 lines. But remember the one was related is which of the following fluoride has a choking off effect? Sodium fluoride, stannous fluoride, acylated phosphate fluoride, amine fluoride. That time you have to go for sodium fluoride as the answer. Okay. Choking off effect is nothing but, see, when you apply the sodium fluoride onto the tooth surface, that will react with the hydroxy uptake crystals present in the tooth surface to form calcium fluoride. Now, by further diffusion of the sodium fluoride onto the tooth surface with the hydroxy apatite will block the entry of fluoride ions. This further blockage of entry of fluoride ions is called choking off effect. Okay. Second type is stannous fluoride. Stannous fluoride, remember, in children you'll be using 8% of stannous fluoride, whereas in adults you'll be using 10% of stannous fluoride. I told in sodium fluoride, what is the technique? It is Knudsen technique, but in stannous fluoride it is Muller technique. Remember that. Here it is a paint-on technique. So what are the 2 main concentration? Here low and high concentration is formed. Remember, in low concentration, what is the end product, and high concentration, what is the end product? In low, it is thin hydroxyphosphate, and in high concentration, it is calcium trifluorostannate gets formed along with thin trifluorophosphate. Now, next going on to acylated phosphate fluoride. Here, 1.23% of pp ppm. That is 1.23% of APF gel is used. ppm is nothing but 12,300 ppm is present. Here the solution name is Brody-Watt solution. Dicalcium phosphate dihydrate is the end product. And fourth type is the amine fluoride, which was given by Mulliman and co-workers in the year 1957. Here comes the comparison between sodium fluoride, standard fluoride, and acetyl phosphate fluoride. This is one of the important one-word question related to NEET. This tabular column, memorize it thoroughly. For sodium fluoride, what is the percentage we use? 2%. And for fluoride concentration is 9,200 ppm. The pH is neutral. Frequency of application 3 years, 7 years, 11 years, and 13 years. There's no adverse effect. This 30% of caries reduction. Standard fluoride 8% is used, 19,500 ppm, 2.4 to 2.8 pH, and it is biannually applied. Adverse effects is tooth pigmentation and gingival irritation. There is 32% of caries reduction. APF is 1.23%, 12,300 ppm. pH is 3, biannual 28% of caries reduction is seen. So this is related to the gels. Now next coming to dentifrice. Remember dentifrice, there are 4 types and it was given by Bibby in the year 1942. There are 4 types of dentifrice: sodium fluoride dentifrice, stannous fluoride dentifrice, monofluorophosphate, amine fluoride dentifrice. So fluoride mouthwash was given by Bibby in the year 1946. What did I tell for fluoride dentifrice? It was Bibby in 1942. The same Bibby gave mouth rinse in the year 1946. So remember, what is the weekly applied dose for mouth rinse and daily applied dose? Weekly is 0.2%, whereas 900 ppm, and for daily it is 0.05% to 25 ppm. Now this is the mind map related to topical fluoride. First, remember, when you study a topic, put a mind map so that you will easily remember all the stuffs. Okay. So here there are 2 types of topical fluoride application. One is professionally applied and another one is self-applied. Professionally applied is prophylactic paste, fluoride varnishes, gels, foams, restorative materials. So what are the fluoride varnishes? We studied 3 types: Durafit, Carex, Floor Protector. So what is the ppm you have to remember for Durafit, Carex, and Floor Protector? Okay, remember that. For gel, there are 4 types: sodium fluoride, stannous fluoride, acetate phosphate fluoride, and amine fluoride. First, sodium fluoride, you have to remember what is the technique. What is the technique? Anybody? It is Knudsen. So remember, it is Knudsen. For stannous fluoride, it is Muller's. For acetate phosphate fluoride, it is Brody-Watt solution. And amine fluoride, who gave? Mulliman in the year 1957. Self-applied, there are 4 types: dentifrice, mouthwashes. Now, let us test ourselves how much you remember from the lecture I have given you. Okay. Now, these are some examples of MCQs you will be asked in your NEET exam. So, which of the following is a fluoride varnish? Durafit, Floor Protector, Carex, all of the above. So, which is the answer? Do you remember? It is all of the above, because all the 3 given options are fluoride varnishes. Here you need to remember another one is the ppm of each fluoride varnishes. For Durafit it is 22,600 ppm. For Floor Protector it is 7,000 ppm. And for Carex it is 18,000 ppm. So you have to remember this one word related to fluoride varnishes. Now, see, this one example I have given you in related to what they will be asking during your NEET examination. So, this will apply for each and every topic you study in your NEET exam. Okay. So, make sure that when you study a topic, you would say, study all the one words related to the topic itself. So, this is second question which I discussed in your previous slide. What is the ppm of Durafit? It is, do you remember? It is 22,600 ppm. Who gave amine fluoride? It is Mulliman in the year 1957. Knudsen technique refers to the sodium fluoride. What techniques come for stannous fluoride? It is Muller's technique. And for acetate phosphate fluoride, that is What technique it is? Broody word solution. So these are all the MCQs related to tropical fluoride. I have discussed you all related to the NEET examination. So remember, you should study when you take a topic, study all related one words and make sure that you master that topic. All the very best for your NEET examination. Thank you.